People often ask, what does it take to be a nurse? To be a nurse means you realize it's not about you. You see, it's not about you or I, what we think is normal, or what we've been through or not. It's about the lens of the person we're called to care for. It takes a lot to first search for and name any biases that we might have about people's lives or so-called choices. It takes even more to work to change them. What happens when women come forward to healthcare professionals during times of sadness, worry, or distress? And how is the distress, worry, or sadness viewed or received? Nurses, by virtue of our position, are at the center of women's experiences with psychiatric hospitalization. And so what do the women themselves want us to know? What lenses are placed over top the women's voices? Are women believed? Are they heard? What leads to women being placed in psychiatric institutions in Canada? And what is their experience like? Whose voice matters? Whose voice counts? And what if nursing students, at the precipice of their career, had the opportunity to hear from women themselves? This film seeks to explore these questions and to honor the women who came forward and those who wanted to. And it is an offering to all nursing colleagues and future nurses to consider.
How do I describe my psychiatric hospitalization? It was lonely, and it was it was scary.
Middle ages torture. It's an indignity. What I want to say is an indignity. I was treated in an undignified, disrespectful way.
Hey, if I had to encapsulate it in one noun, that noun would be nightmare. It was horrible. It was a combination of terrifying, painful, and unbearably boring.
I can tell you that the psychiatric hospitals tortured me, humiliated me, degraded me, gave me 15 different types of medication in 18 years.
It was noisy and there were a lot of people yelling all the time. It was very difficult to feel any sense of peace with all of this chaos around, and change of regime, change of routine, change of freedom.
Comment tu dirais ça? Je trouve que c'est un monde d'indifférence.
Because of having an alcoholic family, and also I was bullied at school and so, but I wasn't the type to curl up and die. I'd always fight back, and because they were able to gang up on me, and there was more than one of them, the teachers would always take their side. And so I was constantly being accused of having behavior problems, although it had, really had nothing to do with me. It had to do with how I was treated. And so I had psychologists and child psychologists prodding at me from the time I was about 6 years old.
I had my plan in place of this is what I was going to do, and it had nothing to do with home. It was I don't fit here. I don't belong here, and so I woke up, and I must have taken, I don't know, 50, 60 pills, my orange juice, and that was that. But I ended up going to the hospital.
So everything fell apart, and I fell apart and went bonkers. I was taken to my family doctor, and he had me locked up.
I went into the hospital when I was 17. I was trying to get out of a bad relationship at the time.
They called me super nurse on the unit because I was really capable. I was young, and the next day I was to start as charge nurse. And this man drove me crazy all day. His mannerisms, everything was like my grandfather. So into bed, and shift was over at 3, and I'm in bed by 3:30, thinking, I can't do this. I can't do this for another 42 years of my life, for one thing. And something's really wrong, and I don't know what it is, and I just want to die. So by the end of the evening, I was admitted to the unit in the same hospital where I worked, mental health, which was a shaming experience in itself, walking in with my suitcase, past the school of nursing. It's horrible.
A broken relationship occurred on top of, and of course all the reasons behind that, which we won't go into it. And then my father died, and my family sold the family house, and so everybody sort of scattered to the winds.
My father was a wife beater. My mother beat me and my brother, and she tortured the animals. So I came from a very dysfunctional home, and my uncle, when I was 4, molested me. So I left home at 17. The school psychologist told me to go to a hospital.
The doctor sat me down and he said, well, I'm going to give you 2 choices. You can go willingly or you can go unwillingly.
This is just the absolute frustration and anger and craziness that I felt being there. I would scream on the unit, but without making a sound, because you couldn't make any noise or you'd cause a fuss, right? I would never do that. So I screamed inside, just like this crazy.
You could hear it inside.
I could hear it inside.
You could feel it.
And that way, it was sort of an outlet, but not.
They locked me in this room with nothing in it. Nothing. A chair. And I think one of those plastic mirror things that you can see on walls. I guess that's to protect you from hurting yourself. And they sat me in there for 3 hours, like isolation. It was unbelievable. I thought, wow, that's a great way to heal people.
I felt like a caged dog. That they put me in a corner and they were caging me.
Like, the bus shelter, that's how big the room was. And there was a bed there and a chair. And that was it.
They take your clothes and they take everything that you have, and they put me in a room right behind the nurse's station so they could constantly be watching me, and you couldn't close the bathroom door all the way, and the room's just bare and really depressing.
They forced the medication on me. I had to take it.
My recollection is that it was 12 pills 4 times a day. I don't know if that's accurate, but it was a ketchup cup full of Haldol.
I took many psychiatric drugs, 15 different types, and I emailed David Healy, who wrote the book Let Them Eat Prozac. I said, David, here's the list of the 15 psychiatric medications I took in 18 years. Which ones cause brain damage? He said 7 of them cause severe brain damage. He told me in the email.
But now it's drug cocktails for everyone, pretty much. I don't know anyone who only gets one kind of drug. They give you everything for every diagnosis.
Because of the side effects, the drugs made me more hopeless than I had been. I think because look at how fat I got, and
we're going to give you those needles, which are against the law, called chemical restraints. A big needle in the hip, and then pulling my pants down in front of these 4 men, with a big needle, was it's social control. This is what they did to me.
Sometimes I just ask it, I want to see my girl, and they say me, I'll take this pillow and I get to sleep a day, and I was sleep on Calorify, and that's take me a big burn.
when they'd force you to take medication, and it's like the nurses would, like, it was the most humiliating thing. It's like you were like 13, 14 years old, and the nurses would finger sweep your mouth to make sure that you'd swallowed your medication. And it used to take all my self-control not to just start biting when they'd shove their fingers into my mouth.
It was just awful having to live through the days of nothingness and tedium and not being allowed to go outside and, you know, having all liberties removed along with your ability to think clearly, and the so-called side effects, the effects of the crap that I was on were excruciating.
I didn't know I was there, and I didn't know what's happening. And for the 6 months I was at hospital, I didn't see much of them.
They should have more respect and be much less brutal.
Yeah.
Because when they put us in that room under convention, we are in front of 12 or 15 men, and completely
Naked.
When I had to take a shower, public shower, in a long-term care facility, and I said, "Can I take a bath?" "Oh no!" So we lined up naked, all us women, with no shower curtains and the shower stalls, and I think that was a way to break our spirit. I was very humiliated. I just gained 30 pounds, and it was just very humiliating.
I said, I'm a bit untidy. I need a comb. Can I have my comb? They had allowed me, I guess, my purse. If I had brought my purse, I think I did. They took everything. They said, no, you can't do that. I'm going to give you a gown, and you're going to wear that. This was the ultimate, you know. You're not even going to give me the dignity. This is, you know, somebody who's suffering really low self-esteem already, and you won't even give me the dignity of combing my hair with a plastic comb.
The nurses would, the nurses would basically mock your pain and just, like doctors and nurses would just make fun of your pain. And
psychiatric ward, I don't have to describe it. It was hell. I was lucky because I was a good girl, so nothing bad happened to me except being a bit molested here and there, just having bad vibes from people. But
so she feels that the medical profession hides a lot of stuff to protect doctors, because a lot of mistakes were made in her life, Francine, by the doctors. She was abused in psychiatry. She was also sexually
with penetration and so on.
She was raped in psychiatry.
It was very scary. It was very scary, especially because of the fact that you know that the doors aren't. You can't close the doors.
You know, I felt like a trapped animal. I felt the other people felt that way. That the bars and the windows not being open, you can't open the windows, and every door you go to is a locked door, and somebody attending it, and it's just, like our friend said, it's a nightmare.
This lady, she would come into my room. I was locked in this place. I couldn't get out 6 months at a time. And we had these really rough bedspreads and one little cupboard for your belongings that they would let you keep. And she was really not a well person. Like, I don't know what she was doing in with people that were acute, but she'd been in the system a long time and was quite disabled. She came in, and when she would go through my stuff, I'd say, "No, Jeannie, you can't have my things. Like, this isn't all I got, right?" And she just hauled off and slapped me across the face, so it left big marks. And I remember walking out of the room, crying, and going to the staff and just saying, "I gotta get out of here. You gotta let me go home. This is a crazy place."
Well, I'm going to be very frank. They have the psychiatric hospitals, I call them psycho prisons. They are worse than a prison, because at least in prison, I've never been in prison, but at least in prison, you know how long you're going to be in for.
And I don't think even today you have a choice. When they say 10, 14 days, they don't really mean it, and that's a betrayal. That is a betrayal. You sign something, and of course it's in the paperwork, and there's no escaping that.
I thought I was going to lose custody of my children. I thought my boyfriend was going to leave me. I thought I was going to stay crazy for my whole life. And I thought that I was in prison for life.
I wonder, what have I done? What did I really do? I'm a prisoner now in these hospitals when they sign me in, and I can't get out. And I'm treated like a bad person, like a prisoner. But I don't know what I did.
You could only talk to the psychiatrist for like 10 minutes a day maybe, or every couple days. They thought that the pills weren't kicking in as quick as they should, so after I was in hospital for about a month, then they decided to use ECT on me. My parents consented to because I was only 17, and they didn't make it clear how bad the memory loss could be.
And I got 167 shock treatments under general anesthesia from 1980 to 1984.
I was terrified. They put me on this white bed with a white sheet. They wrapped my legs with a belt. They strapped my arms down. They put a band around a rubber band around my head, and put a rubber mallet so I wouldn't swallow my tongue. Gave me a needle to relax my back muscles, because years ago people didn't get that needle to relax their muscles, and sometimes it broke their back by all the convulsions. And I looked, and there was this white machine. I said, "What's that?" I said, "We're going to put electricity through your brain." I screamed, "Don't give me this! Get me the hell out of here! Get me the hell out of here!" I said, "You're going to torture me."
I can't really explain the frustration, the sense of frustration, because over time, living in something like this where it just never stops for so long, it went on for about 20 years, you just can't imagine how bad it is to know this sense of craziness.
And to this day, they're still giving electroshock in 130 hospitals.
I knew that if I quietened myself down, they would leave me alone. That the more fuss I made, the worse it would get. And I think the nurse said that, and congrats to her, because I think that's what happened, which allowed me to get through that without having these other things forced on me. And I've seen that, and I witnessed that. People in there get more excited, and as they get more excited and more agitated, more pressure and more security gets forced on you, and then you become angry, and of course you're going to act out. That's just the way things go.
And my mom told me, "Be a good girl. Do what they say, and you'll come out of there faster."
You have to play this game. Pretend that you're well to get out. Because if you say you're depressed, you'll never get out of here. So I said I was fine, and I wasn't fine.
If as long as you do these things and we can see that you're okay, you can go home. We'll lift the form. As suicidal and desperate as I'll get out, but as long as I do certain things, I can leave.
What were some of those things that the expectations?
They wanted me to say I was fine. They wanted me to participate and talk and not talk about feeling suicidal or hopeless or wanting to cut. Say the right things and you can go home.
I didn't feel like it was because I felt like I was a criminal. Like I felt like I had done something wrong.
I gave up on the mental health system completely because it hasn't met my needs. I've been forced into it since I was about 13 years old, even before that.
Like when I went to the hospital, I really thought that they would have an answer for why I was feeling the way I did, and they didn't. There was just a lot of theories. Like I thought that maybe they would give me tests or something, and there wasn't that. And so if ECT was the last thing that they could offer me, I guess maybe I knew somehow that I should be out of there.
What's happened is women who have been traumatized, most of them come in have been traumatized by something, and then what happens is psychiatry is oppression, so they're being re-victimized, re-traumatized again.
Nobody's able to help me. Nobody knows how to even approach this. All they do is say, take this drug, we'll give you another prescription, or we'll lock you up and keep you there for a while, and that should help.
It's like one of two choices. If I went to the hospital and said I'm in crisis, either they'll accuse me of hysterical attention getting and send me packing, or they're just going to decide that I'm a danger to myself and others and chain me to a bed and inject me full of Haldol.
When the psychiatrist says, you know, you can't keep doing this, and I'm thinking, so then you're not helping me get better, because you're blaming me now, but you're not helping me. And then you stick me in the in the solitary confinement, but I didn't do anything.
Not helpful having locked doors, an atmosphere of shame and blame. It's your fault.
Yeah.
It's always your fault. You're the person who's refusing help. You're the person who's different. You know, and just being different is apparently a problem. It's just I couldn't get my head around that. It was just too much for me. And I think having these sort of rigid schedules, no freedom of choice whatsoever is a big barrier.
And the more they treat you like this and don't give you a voice and don't believe you, the crazier you get, the worse your behavior gets. So if we look at people that they label as borderline, who behave and behave and behave in bad ways we don't like, and we try to put constraints on them and tell them that they're, you know, what do you think it's going to do to the behavior? They're going to feel more boxed in, less believed, and it takes more behavior to convince somebody of something that is too hard for the patient half the time to even figure out.
Well, that's anger, because, I mean, if you cage a dog or an animal in a little cage for a long time, they're going to start to act out. First of all, I didn't like being locked up for no good reason. The medications were getting me heavy. I was always thirsty. I was sleeping all the time. They weren't listening to me, and they weren't asking me about my mother and the way she used to beat me, and my father used to beat me, and my uncle used to molest me. They weren't dealing with the issues that I want to talk about. They said, oh, no, we won't deal with that right now. You're too traumatized. We'll talk about it later. They never dealt with any of my stuff. All they wanted from me was to get money to medicate me, get money to give me a label, and the word, I mean, when they keep you on the word, they make about $1,000 a day. So the longer they keep you on the word, the more they're going to make.
We're not seen as individuals. We're not seen as human beings with rights. We're seen as disturbing, annoying, irritating, out of control freaks who need to be made to conform. And I know that the people who I speak of as my keepers and think of as monsters got into the professions probably all the time for good reasons. I think that because of the paradigm of broken brains, there's no respect and the point is missed. The point that when people go through a crisis, there's a reason for that crisis, and the manifestations of that crisis have meaning is missed. And that's tragic.
They don't consider us like human beings.
We're less than animals.
Yeah. I wish sometimes to be an animal.
What manifests it and encapsulates it for me are the locked windows.
Yes.
You can't see out of them, and you can't budge them. And it represents everything that it is, which is sort of, again, it's punitive rather than healing, and you can't have the two. They're just counterintuitive.
You want to talk with the infirmière, the nurse, but they don't have time. They have just to have the rapport to make, give you medication, and sometimes I was to ask a nurse, I want to know my child, like I said before, or can I phone? They just say you wait, go get your room.
Like I was saying that I had flashbacks and I'd been abused, and the social worker or nurse or whatever she was would just said, oh, well, if you were that age, you could have fought back.
Yeah. They're prejudiced. They're prejudiced because they don't talk to you. They don't treat you as a human being. So they don't know where you come from, and of course you're looking for answers. So you're ranting, you're talking. You want somebody to listen to you, and when you're there and because you were breastfeeding 4 hours before, and now you're trapped, and you know you won't be breastfeeding for the next 30 days, and your breasts are hurting like crazy, and you want somebody to help you, and they look at you and they say, you can see it in their face that they feel like you're sexually more open because of the illness, and you're obsessed with your breast, and also that can trigger some ideas in some employees that are not, that shouldn't be there.
So what's helpful is when they actually bloody listen.
Would be nice if I could just reach any human.
Yeah.
And the other ones were not functioning because of the drugs.
It would have been nice if somebody had said, I understand what you're feeling.
And all I wanted was a home, someone to care about me, and I went to friggin' psychiatry to torture me again. So I was tortured for 17 years in my home, and then 18 years with psychiatry. Those bastards didn't want to listen to what my parents did to me or my uncle. All they did was they abused me, and I got the hell out of there in 1990. I fired the shrink. I said, to hell with the pills.
Tell me about that.
Because it just re-traumatizes you, it invalidates you, it invalidates your experiences.
The person that's supposed to help you doesn't know how to help you.
The other patients were very helpful. Some of the other patients helped me in all kinds of ways. We helped each other. We helped each other survive the experience, and it was, the positive interactions that I had with them were a lot of what made me want to get out rather than just want to kill myself.
Well, the only helpful person I had on my ward was the lady that did the cleaning on one ward. She used to talk to me, Violet. She used to come around and talk to me. She was non-judgmental, non-threatening to me.
The person who really helped me was a nurse. That night, that after the diagnosis, and I was imagining myself living the life that Michelle was describing in a way, having my children taken away. I thought about suicide, and it was the first time in my life, for real. And they had done that to me. And I was sleeping with my bathrobe, and I asked the nurse to put the bathrobe away because I knew I had the belt, and they wouldn't let me wear a bra, but they let me have a belt for the bathrobe. Needless to say, my breast was like. And she came to me and she spoke to me. She was the first person she spoke to me. It was nighttime and it was after curfew, and I asked her, I'd like to talk, Nobody's talked to me. I've been here and I've been on pills, and she took me in the little kitchen for the employees, and we had tea together.
Nina, the nurse, was my friend, and she was kind, and she listened to me, and she obviously had empathy, and I was so debilitated by the drugs that I couldn't wash myself, and she would come in the shower and wash me, and she was so humorous and nice about it, and I really appreciated her.
When one of the male nurse, I presumed he probably had a child at home, brought me some ice for my breast, and he did it in a real, distinguished manner. That was helpful, you know. Giving me privacy so that because eventually I got my pump, my breast pump, giving me privacy because I didn't have any privacy. Our doors wouldn't shut down. They had windows on them. He put a towel over the window so that I could express some milk in privacy. But I mean, you know, the rest is just inhumane. So what helps is talk. You want to have somebody talk to you. You don't want to have somebody just kick you on the head with some medication.
I didn't see the nurses and other staff so much as human beings as monsters, but that one woman was a human being, and I was really impressed. And she was young, and I do think that a lot of burnout takes place in that kind of job.
The impact for this was devastation. It ruined me. By the time I was done, my hospital years, I hated nurses and doctors, everybody to do with the system.
Yeah.
Life is not too great. I have a lot of memory problems from the electroshock still that I had in 1973.
Because I lost definitely a few years of my life of memory. It was pretty horrible. I still don't have that back.
And I can't learn anything new. Before electroshock, I had no problem in school. I was at the top of my class, and now I went to university in 95 and I couldn't remember what I was learning. You can't learn if you can't remember. You can't get a good job if you don't have a good education. You can't learn if you can't remember what you're learning in school. You won't get that degree to get a good job.
And then my mom invited some friends over at Christmas because here I was home. Well, I was like a zombie. My friends would try to talk to me, and I was like nothing was happening up here. It was like they'd wiped out my ability to think too. And my friends, that was it. I lost my friends.
Lost your friends.
Oh yeah, girlfriends that I'd grown up with, right? I think they were pretty horrified.
She says that she was really hurt by psychiatry. She was diminished, and then now she's stuck with that, and moins de capacité. This has reduced her abilities.
I did. I lost everything. I lost my friends, and I lost potential for a normal life in my young adult years.
It changed the direction of my life because it gave me a stigma.
We lost the credibility in front of them. And regarding the society, we have been stigmatized, marginalized, we are discriminated.
I think that was the impact for me. I went out feeling worse, feeling labeled, feeling branded. Everybody on campus knows now or something, you know, and behaved differently as a result of it because it was almost like self-fulfilling, you know. Well, now they've taken away my last shred of dignity, so it doesn't matter what I do.
After I got out of the hospital, I felt really isolated, had a hard time interacting with people, and I felt really lost, and it was really hard to get back into learning and remembering. I was also on medication for a few years after I got out of the hospital. I was told that it was going to be something that I would have to do for the rest of my life, but I ended up, I'm not on medication anymore.
I had gained weight, but then I gained 100 pounds more on Zyprexa, of course, olanzapine, and they gave it to me to try and stop my thoughts of wanting to cut and kill myself. It was just, by the time I'd been through this, the thoughts of wanting to die that's all I could think about.
I think I came out of there very almost disillusioned, and I felt like nobody cared. Nobody cared enough to really want to help you, and that it was almost like, why bother then? Like, why? why bother? You could have just left me. But instead I go into the hospital, but they don't help me either.
I was tortured by a bunch of bastards that continue to torture my peers in the so-called name of medicine. And the Hippocratic Oath says, I shall not hurt anybody. And they continue to torture people with their medications, with their electroshock, with their bogus diagnosis, with their 4-point restraints, okay? And what they do is they humiliate you and degrade you into thinking you're sick with a bogus disorder.
It's basically added to my trauma, even now.
I still have nightmares about ECT, the counting backwards, and like the taste in my mouth.
Yeah. Like it's contributed to the nightmares. It's just been a worse impact on my post-traumatic stress.
And I still carry shame. I still carry huge amounts of messaging in my head. It's always the same messaging. You're not good enough. I'm filled with doubt, or can't do that, or what if I start it and I fail, or I freak out, or what if I just have a normal angry reaction? What will they do to me? Because we've got this sort of trail of the paperwork trail.
I will never be in the hospital again because of my experience. My friends and family now have to be the one that help me deal with my problems and myself, because I won't be on medication anymore and I won't be hospitalized anymore for any of feelings or behaviors that I have.
With the shock treatment, I developed acrophenia. And
tinnitus.
And the fact I'm afraid to be treated, because I was afraid that if I see that I have noise in my ears, that I could be accused to have auditive hallucination. And for about 5 years, I have problem with my eyes. I see like a foggy picture. And finally, I have a cataract, but I was afraid to see a doctor because I was afraid that I could be told to have visual hallucination.
Having ECT and being hospitalized was a really bad experience for me, but it also gave me a purpose, because now I know that it's really important to have all experiences of ECT considered before people make a choice about having it, because shock therapy is something that can haunt you for a long time, and I don't think my parents could have been aware, or I could have been aware how much long-term effects there were, and I don't think that the doctors try to make it clear.
But I think today I'm a people broken. I'm broken inside.
It's a huge opportunity for people right now to make these kinds of changes that we've been waiting for. And now it's your time.
What happens is you get into psych nursing because you care about people and you want to help them, and then you're working with all these people whose behavior you have to control, and you get jaded, and the kind of, it gets to be a chore, and because of the education that medical professionals get, which is kind of governed ultimately by the drug companies.
If I could ask nurses anything, it would be to think about how they would want to be treated if they were in a position of someone who had been identified as mentally ill and was in the hospital, and really try to have compassion towards them. People in the hospital are in a vulnerable position, and they really need from nurses: empathy, support, and love.
Think about, I would want to say to nurses, think about how it might be if you were the patient.
Yeah, I think you don't know what it feels like to have yourself strapped down, totally, completely incapacitated, internally and externally, and at the mercy of other people's decisions around your life. It's not their life, it's your life.
Caring for people should be with your heart, with your caring, your dignity, and remember, the person is not a label. The person is a human being that is traumatized and they need your caring. And be careful of what goes around. Like electroshock is not okay, the pills are not okay, and the labels are not okay.
Do try not to label people in your mind. Do have a sense of people's humanity. And their core journey is their journey, not yours. You're helping them find their journey.
Like everybody can say before, to be human, and importantly to know the person, to talk with them.
Pay attention to the people. Okay, if you're wondering why somebody is agitated and upset, if you see somebody, okay, maybe the fact that they're being handcuffed by the police and slapped around and being chained to a bed in restraints has them agitated. Like that would, I think like anybody should realize that would be enough to agitate somebody.
I don't believe that we're supposed to be highly medicated just because we're depressed. I don't think that we need to be tied up or put in solitary confinement because we appear to be a threat. But I just think that if there was compassion, or if somebody could just step inside the person's shoes and really try to understand why they feel like that, instead of making them feel like they're to blame and that they're doing causing more work.
Shutting people down is not help.
Stop telling people that they need to be medicated when they're in distress.
Let those things go. The medication is a big piece of this. Once you medicate somebody, you're not getting the authentic person, you're getting the medicine, you're getting the drug, and you're numbing people to their experience. You're stealing from them. That's important to recognize.
Really encourage nurses to just step right back and question everything that they do, everything that's said, every single thing that has to do with their job.
I have to tell them that nursing can be a very good experience, but they should keep their eyes and their heart open and not listen to the doctrine and the brainwashing by psychiatrists who will tell them, Mrs. Brown or Mrs. Joe, she's a schizophrenic, she needs her medication, we think she needs electroshock. I would like the nursing students to open their hearts to the truth and realize that psychiatry is not a real science at all, okay? And that they need to open their hearts and treat the people with respect, caring, and love, and realize a lot of these people have been abused in their past or have addictions, and that labeling them and telling them to take their medications and keeping them on locked wards is not going to help them at all.
Take feedback from people that you're helping and supporting. Take their feedback seriously. Take it with the depth that it's offered in, and don't allow your mind to be closed down by rules that in your instinct you know to be wrong.
I'd really want to talk to them about judgmentalism, about questioning what you've been taught.
You may feel like you need to say something to somebody who's going through a difficult time, or even somebody who's just reaching their crisis point. Listen to what they're saying at a deep level, and they will change just by that. They will find their way just through that.
I always believe that if you truly want to help somebody and care, then there's ways to do it without making a person feel like they're to blame. And I think that in today's world, we're so rushed and we've got to take care of this, that, and the other. And I just think that if you take the time to listen and really listen to what a patient is saying or a person, then maybe you can have that empathy, and that will make them feel better.
Things are perhaps getting a little better, but it's still the same. Still the same thing.
What does it take to be a nurse? The women whose narratives now fill our collective consciousness have told us. They've asked us to embrace and protect their dignity, to see them not as a label, not as something terribly flawed, not as a series of bad choices, not in need of being calmed down or worse, shut down. But rather they ask us, all of us, to not label, blame, abandon, disbelieve, or disconnect. They ask us for compassion. They ask us to keep our eyes and our hearts open and to see their past abuses and hurts. They don't want to be drugged. They want to be heard and affirmed and valued, not numbed, not pitied, and never dismissed. They want, in fact, to matter. They gently invite us to be open to feedback and to take in what they're saying to us. They want us to change practices that we know to be wrong or harmful, and that we challenge the judgmentalism and the indifference they told us enveloped them upon their entry into psychiatric care. One of the Francophone women, upon reflection of the impact of psychiatric hospitalization, told us that the light inside you closes. To these women, what it takes to be a nurse is having respect, compassion, being engaged, having deep regard and concern, and being non-judgmental. What they want from nursing is what nursing wants from society. We're not that different, actually. I've often thought that health is a matter of who matters, and that really is the essence of nursing. To listen at a deep level and to hear.